grips Hong Kong as a deadly new virus sweeps through the city.
The Dow Jones down 173 points. Prices are soaring. The wholesale cost of a dozen eggs is up 36% in the last 3 weeks.
Airports around the world are rushing to install thermal imaging cameras, which prevent the spread of swine flu.
Stocks continued to sink Wednesday over fears about Ebola and fragile economies in the Eurozone.
The fear of MERS in the public has had a domino effect on the entire tourism industry.
Airline stocks were also tumbling.
The warning about travel to Brazil is the strongest one the CDC has issued.
The Zika virus hitting Latin America has sparked global fear.
Infectious disease outbreaks are occurring all the time. Most are quickly contained, but despite modern medicine, epidemics continue to pose a challenge. We sent our correspondent Sarah Navisi to any country to investigate rumors of a number of mysterious deaths in one of the world's most popular tourist destinations.
Touristville lies at the heart of a mountain range in the eastern part of any country. Most of any country's 8 million inhabitants live in one of the three main cities: Capital City, Touristville, and Rivertown. Touristville is the unofficial capital of any country and attracts large numbers of tourists from around the world. Despite its income from tourism, agriculture, and the mining industry, the average household income is just $98 per month, and the health system is weak. The hospital in Touristville is treating a series of cases of an unidentified respiratory disease. 18 people have been affected so far, and 10 have died. The doctors suspect an infectious disease but cannot identify it. Standard treatment has little effect. 6 of the 10 people who have died were healthcare workers who were infected while treating patients from the surrounding mountain area. The health authorities have not yet made any official statement about the unusual concentration of cases at the local hospital. This is Sarah Navisi reporting from Touristville.
An unidentified disease has been affecting young and old alike. And today, we have had official confirmation of the nature of the disease. It seems it is a new respiratory virus, which experts have named the MARS virus, Mountain-Associated Respiratory Syndrome virus.
Initial laboratory tests have revealed that the new virus belongs to an unknown family of respiratory viruses. It's probably transmitted directly from person to person via airborne droplets or contaminated surfaces and causes shortness of breath, fever, and a dry cough. Many patients require intensive care, many die. Research facilities worldwide are offering their help. What they need right now are samples of the virus for research purposes and for developing diagnostics and countermeasures.
The next step will be to analyze the virus more thoroughly and to develop ways of diagnosing and treating it, and if possible, a vaccine. But for this, we rely on receiving samples and access to any available data.
And of course, we ask ourselves, should we worry? With me is Cho Chang, a health expert who specializes in epidemic control. Looking at any country, how do you assess the situation?
Any infectious outbreak must be taken seriously. In our interconnected world, a risk anywhere can rapidly become a risk everywhere. To contain an outbreak, you need functional hospitals with trained staff. You need labs to confirm a diagnosis. And you need a surveillance system that is capable of detecting cases. If a health system cannot provide these services reliably, further spread of an outbreak is inevitable.
Breaking news, the health crisis in any country is spreading globally. First cases confirmed in our country. Fear and panic rise. Stock markets are falling. Flights have been suspended.
We bring you breaking news of the first confirmed case of the virus in our country. Welcome to World News. My name is Lily Zen. Hospital officials state that the patient is being kept in isolation. The 42-year-old man is thought to have contracted the virus while on holiday in any country. When he developed symptoms of the virus, the patient was immediately admitted to the hospital's isolation ward, and samples were taken for laboratory analysis to confirm the diagnosis. Several hundred people have already died of MARS in any country, and the number of new cases is still rising. Any country has been forced to declare a national emergency. 27 confirmed cases are reported all around the world. The WHO Emergency Committee is holding a meeting in Geneva and preparing to give a press conference as we speak.
Hello, and thank you for joining us.
And I'm hearing right now that we can now go directly to the press conference.
Based on the recommendation of the Emergency Committee, I am declaring the MARS outbreak a public health emergency of international concern. We are seeing the spread of the epidemic far beyond national borders, and there is the need for an international response. The recommended control measures, such as strict hygiene practices, identification of infectious cases, and adequate use of personal protective equipment, must be enforced. At this point, the Emergency Committee is not recommending any travel or trade restrictions.
The MARS virus is thought to have originated in the mountain region surrounding Touristville in any country, a popular tourist destination and important producer of rare earth elements from adjacent mining sites. Daily flight connections transport both tourists and goods to and from any country. At the airport is my colleague Robert Mills. The most recent flight from any country landed just an hour ago. Robert, now that we are dealing with the first case of MARS infection on our soil, what's the situation at the airport?
The situation here is quite chaotic. Reporters are here to speak to travelers returning from any country. Many are quite relieved to have left any country. Here are some of their opinions.
I couldn't travel with my family because there just weren't enough available seats. I hope they'll be able to come tomorrow, and I hope even more they won't be infected. We are so relieved we got out in time before they started canceling flights. Isn't that what they always do in these situations?
They should get everyone out of there and just close the borders.
There seems to be quite a lot of concern among the citizens at this point. We ask you to be part of the discussion on MARS. Let's have a brief look at what users have posted on social media. Close the borders to any country and let's protect ourselves seem to be very frequent reactions. People are worried about the global spread of diseases. Others are asking why MARS could cause such an outbreak, like this user, who sees the real culprit in any country's poverty. Many posts express people's fear of being infected with the MARS virus, like this one. Oh my God, do I have MARS? As we know, the virus is transmitted by droplets. We produce these droplets by breathing, talking, sneezing, and coughing. The question is how we can protect ourselves from a MARS infection and what we can expect from our government.
They can't even control a tiny virus. It's ridiculous.
Just ban all products from the region and close the borders. Why is that so difficult? The government doesn't care about health issues at all.
It has been 3 months since the first news of MARS reached us from Touristville in any country. Since then, each day has brought more unsettling news on the situation. Julia Anderson looks back for us.
January. Patient 0 is infected and dies. The virus spreads rapidly in any country's weak health system. Any country formally requests more international assistance. May. First cases are confirmed. Through international efforts, the speed of the outbreak is noticeably reduced. Still, fear is spreading, and stock markets are in freefall. Stefan Bork works for the NGO Help Direct.
At the beginning of the outbreak, things were getting out of control, but as soon as the international response kicked in, equipment and people started coming in and the situation improved. Our current impression is, however, that funds and the interest in this epidemic are decreasing. It's very frustrating. I'm not sure where this is heading.